Okay, this video I'm going to show a little bit about kinesio taping for the neck and how it affects the chest. I find that the clavicle area, the chest area, can affect the neck right through here. And when it does that, now you got neck pain. So as you can see, I did some cupping right here. And I did cupping in the back as well here. And I did cupping, a little bit of cupping right there to like a circle. Because I'm treating the pectoralis minor muscle, which is this muscle that goes from here to here. And that muscle, if it's tight from postural stresses, strains, sitting, everything that we do in our culture is forward. Everything is slouch, and that brings everything forward, and it compresses the lungs, and the head moves forward, it doubles the weight of the head from 15 to 30 pounds on the neck. You could see the dilemma that we have as a culture from being indoors a lot and sitting a lot. Okay, so basically that cupped area that causes blockages of energy. I look at it as energy because we're all frequency based, and I know it sounds kind of ethereal, but you know, if you think about a cell, okay, and we're all made out of atoms, how much of that atom is actually just pure energy? Actually, 99% of it is pure energy. Think about it. You got protons, neutrons, electrons, and the rest of that space of that atom is pure space or energy, where the electrons bounce around. So most of you is space, and so if you don't support that energy or space, I look at that as supporting all the acupuncture fields. With acupressure, that's what I do here. You know, you can treat the energy fields any way you want. You just kind of find out where the energy is being blocked. So typically the energy fields run up and down the body, but in this specific situation, I'm going to treat directly over the pectoralis minor muscle right here. And so there's different strategies for kinesio taping. I get the best tape there is, which is Kinesio Tape Gold, Kinesio Tex Gold. There's a lot of mocks out there. But this one's the best one and lasts the longest. And I have them do it for 3 days. Wear it for 3 days. It works well in the shower. Don't hair dry it because that'll cause it to stick more and become permanent tattoo. Just kidding. But it will be hard to take off. So you want to estimate how long you're going to use it for. So if you measure this distance right here, you want to go a little bit shorter because you're stretching the tape. In his situation, I muscle test to see which way he needs to do it. It could be muscle test for weakness, okay? But in this case, I'm just going to use his muscle to tell me which way to do it. You may see I'm not getting anything at this point because I treated it already, so he may not need it, but I'm still going to do it. I'm going to stretch it out a little bit by tapping it and see that. Hey David, you want me to do okay? You can choose your foods. And so I'm back, sorry about that. I'm gonna do it this direction here. So I'm gonna start the tape down here and pull it up this way. What that does is it pulls the muscle in this direction, and that's what we call a spasm treatment. When the muscle spasm, you want to pull it in the direction of muscle contraction. So if you contract your muscle, this is kind of hard to explain, but basically it's for spasm. So I guess that's the fastest way to do it. If I were to start here and end up here, that's for muscle strengthening if the muscle is weak. In this case, I'm doing it for a spasm. So typically there's tightness in the area. So I'm going to start here and go to here. Typically, you know, the amount of stretch that I do is about 30%, meaning that you stretch the tape 30%. So I'll go ahead and start doing it. So I'm going to estimate this at about, I'm going to do it a little longer than it should be. So I want it to stretch out this much. So that means I'm going to probably cut it right there because you're going to stretch out the rest. So if you turn it around, that's almost about 3 blocks of tape. 3 blocks right there. From 1, 2, 3. I'm going to cut it at block number 3. Just cut it right here at that block. Okay. And then what you do is you peel the ends off about 1/2 inch. And that doesn't get stretched at all. I'm going to start down here. Thank you. and then I'm going to rub it. Now, if there's no oil on there, it should stick pretty good. But if there's oil, you're going to have to wipe that down with alcohol. And just keep rubbing because the heat activates it. Remember, that's why I don't want you to hair dry it. But now, he's got oil on it. Oh, it's pretty good. So this should last, if the oil is not too bad, it should last a few days. So now, I'm going to stretch it this direction, and he's bringing his arm up in the area, so you're going to stretch that muscle out all the way up and back, right there, and stretch it out in the direction of the muscle, so along that other part. I'm going to stretch it about 20% or 30% like this. Okay, now let's put it down. Go back up. We'll wrap it down first like this, as he's stretching it. Get that down. And the rest of it, you don't need to do anything. So right now, what that's doing is pulling that muscle down this way to relieve the pressure or the tightness, basically, the spasm. Okay, and that's really all I'm going to do for that part of for the pec muscle. Now, what he's doing at home is he's going to continue to do this type of thing, his shoulder shrugs. And that's going to help to keep it mobile, because you want, if you don't use it or don't move it, you're going to lose it. Okay? And you want to do both forward and backwards. And that'll keep the energy flow going here. Again, this is not going to stick very long, I can tell you right now, because of the oil. If it starts peeling off on the corners, you want to go ahead and cut it so it doesn't peel further when you rub clothes on and stuff like that. Okay, you're still done. I'm going to go ahead and check him out real quick and then get all set. I'll see you on the next video.